Thank you, Julian, again, and thank you, Brahm Centre, for the invitation to share our mindfulness-based therapy for insomnia. So for today, I will be giving a brief overview of insomnia and the goals for its treatment, followed by a session-to-session description of the key features of the mindfulness-based therapy for insomnia. And I will finish this discussion with the relevant outcomes of the therapy. As Julia mentioned earlier, we had done some research, so I'll be presenting some of that results, as well as discuss some of the possible mechanisms for how this therapy is successful at helping address insomnia. Okay. So insomnia is diagnosed if you experience difficulty falling asleep, difficulty staying asleep during the night, or if you wake up too early, any or all of which results in you feeling not refreshed during the day and making it hard for you to function. If these difficulties occur at least 3 times a week or more and last for 3 months or more, you would meet the diagnosis of insomnia. Now, insomnia may be caused by physiological or biological factors as well as psychological factors that make it more likely for you not to be able to fall or stay asleep easily. For example, you're a light sleeper, you stay up at night thinking about the next day. Environmental factors such as how dark, quiet, and cool your room is where you sleep may also impact the quality of your sleep. Behaviors which includes habits such as using your phone while lying down in bed and having heavy meals before sleep have also been shown to affect sleep. Any one of these or all of these factors may trigger a sleepless nights, and when it persists long enough, may result in insomnia. Dr. Victor Kwok did a good example using a case study of how these 4 factors applied to his colleague and friend Sue In. So what's the goal of any insomnia treatment? The goal of the insomnia treatment is to restore your sleep processes such that you build an urge to sleep and a need to sleep during the day that facilitates you falling easily to sleep during the night, and that way you can be more awake and alert during the day. Successful treatments at achieving these goals have 3 elements. 1, they help the individual form new habits in new environments that are conditioned to promote sleep. They teach skills that help one to relax the mind and body in preparation for sleep, as sleep naturally occurs when one is relaxed and when there is a sufficient sleep urge and need. And 3, to address any myths that you may have developed as a result of the sleepless nights. For example, I must sleep a minimum of 8 hours a day, or without sleep, I'm not going to be functioning, and this is going to be catastrophic for the rest of my day. So many of the treatments can be delivered one-on-one, as Dr. Victor has highlighted, or they can be done in a group setting. Research has shown that both require a minimum of 4 sessions to start to prove to be effective. And while both one-on-one and group are effective, group has the added advantage of learning from one another. So in a group, participants can share, learn, and support one another through their experiences. So it's not all on the facilitator or the therapist, but rather it's a group experience in learning from one another. Okay, so now I'm going to introduce mindfulness-based therapy for insomnia, and this was developed actually by Dr. Jason Ong, who is a sleep psychologist with the Northwestern Medical Group in the USA. And we were very fortunate that he came over and he taught us this therapy, and then we were able to deliver it to a group of 120 people, of course, in groups of 10 to 12 people at a time. So the first thing is that mindfulness-based therapy for insomnia, or MBTI, it employs the attitudes of mindfulness towards sleep. Now, some of you may be familiar with these attitudes, and some of you, this may be the first time, but I'm going to share how this will apply towards sleep. Beginner's mind, or to have curiosity. Remember that each night is a new night. Be open, try something different. What you may have been doing is not working well, and that's okay. We're going to try something different and see if this one will work. Non-striving. So sleep is a process that cannot be forced, but instead should be allowed to unfold. So remember the example of, I need to go to bed at this time. I need to have 8 hours of sleep. and then you're lying there in bed wondering why you still cannot sleep. You've done everything right, but you're still not falling asleep. So at this point, it's more about being able to take a break, realize it's not working, and then if it happens, wonderful. So non-striving. Letting go. Attachment to sleep or your ideal sleep needs usually leads to worry about the consequences of sleepiness. This is counterproductive and inconsistent. So just allowing whatever happened during the day, allowing the fact that you're not sleeping right now to let go of it so that when you are able to sleep, it will come and you can fall asleep as needed. Non-judging. It is easy to automatically judge the state of being awake as negative, and especially if you do not sleep well for several nights. However, when you get judgmental, you get frustrated, you get angry, this makes it then harder to fall asleep. So by trying to not be judgmental, we can change our relation to sleep, and this way it might be easier for us to fall asleep. Acceptance. Recognizing and accepting your current state is an important step. First step in choosing how you want to respond to your experience. So if you can accept that you're not in a state of sleepiness or that sleep is not going to come soon, why not get out of bed? Many people with trouble sleeping avoid getting out of bed, but unfortunately, the more you stay in bed, the more you're conditioned yourself to thinking that being in bed does not help one way or the other. And as Dr. Kwok said, bed now seems to be a torturous environment, going to sleep being a torturous experience. Sorry, someone has raised their hand. Okay. May I understand what raising hand means? Okay, sorry. Then we have trust. Trust your sleep system and let it work for you. Trust that your mind and body can self-regulate and self-correct for whatever sleep you lost the nights before. So creating sleep debt is also okay because you create that sleep urge, you have that sleep pressure. So 2 or 3 days of not having good sleep, but if you build with all the other techniques that I will be sharing with you later, you can then have good sleep, perhaps the 4th night or the 5th night. And patience, be patient. It is unlikely that both the quality and quantity of your sleep will be optimal right away. As I said earlier, research has shown that it takes about 4 sessions at minimum to start to prove to be effective. So be patient with the process. Now, the thing about MBTI, as I mentioned earlier, it's a group-based intervention that also works on changing your habits and environment, teaching you skills to promote a relaxed state of mind and body, as well as challenge your thoughts, feelings, and beliefs about sleep. And as I can show you, this is the outline of the 8-session program, and it's usually conducted on a weekly basis. So here we have all the mindfulness practices that some of you may be familiar. Here are the psychoeducation elements, and here we have all the other behavioral strategies that we teach. And some of you may have heard these terms already in Dr. Kwok's lecture, because sleep hygiene, discussing relationship with sleep, this is commonly found in the gold standard treatment, which is cognitive behavioral treatment for insomnia. And what mindfulness-based therapy for insomnia does is to build upon it with an attitude of mindfulness. Okay. So the first session, we have the mindful breath practice, and we have models of insomnia. So mindful breath practice is to introduce the group members to mindfulness, its concepts like the 7 attitudes as this pertains to sleep, and its practice. Group members are also provided psychoeducation about insomnia. So it is important to know that there are 3 factors associated with one having insomnia. We call them the predisposing, precipitating, and perpetuating factors. The precipitating factors increases the likelihood of one getting insomnia. And this could be physiological reasons like Parkinson's disease, thyroid condition, or maybe your sensitivities to certain medication. while the precipitating or triggering factors is what usually creates the first instance of sleepless night. Now, if you just started to have sleepless night, it doesn't mean that it's going to persist. Unfortunately, for some of us, we start to have thoughts about it, have anxiety around it, change our behaviors such that it perpetuates the phenomena of insomnia for 3 months or longer. While the predisposing factors are often biological, or also, if you're psychological, if you tend to describe yourself as an anxious person or easily stressed person, or someone has difficulty with processing anger. There's also precipitating factors like a thyroid problem or psychological factors like grief from the loss of a loved one or anxiety over a stressful situation at work, and even a change in environmental condition, meaning you moved house, there's jet lag, there's change at works in your shift. All of this can precipitate the first few nights of difficulty sleeping. And as I said earlier, over time, sometimes in order to manage these difficulties, we may adopt unhelpful thoughts, beliefs, and behaviors that cause these sleepless nights to persist longer. And after 3 months, we feel helpless and we feel that we cannot function, and it causes us distress, resulting in us having insomnia. For the second session, we start talking about stepping out of autopilot. Autopilot being that, we switch on and we just go on without being aware of what we're doing, what we're saying, what we're feeling. And mindfulness is about coming out of autopilot. So with the second session, we introduce a new practice, which is the body scan practice. We teach a little bit about sleeplessness and wakefulness, and we bring up sleep hygiene, as Dr. Kwok highlighted earlier. So the body scan practice encourages attentiveness to one's experience of one's body. The improved understanding promotes recognition of when you're sleepy, when you're fatigued, and when you're awake. And the body scan is also a practice that one can perform lying down in bed before sleep. Unlike the other practices, which involve you to be out of bed and preferably not to do it prior to sleep, because the more practice of mindfulness, actually the more awake and alert you can be. In fact, just the practice of body scan alone on a daily basis after 6 weeks with adolescents helped improve their sleep. So as I said earlier, this is sleep hygiene. So here we bring in sleep hygiene and we encourage the members of the group to think about what behaviors that they can change, and together with the body scan to practice it on a daily basis. The third session, we really want to go into the idea of sleepiness and wakefulness. We also teach now mindfulness around movement. So it's another way we can reconnect with our bodies, but this time, instead of just lying down and being stationary, we do it with movement. And the behavioral practice that we have to change a habit is sleep consolidation. So sleepiness and wakefulness. Falling asleep is easiest when we are sleepy. However, many confuse feeling tired and fatigued with sleepiness. When we are sleepy, we are barely able to keep our eyes open and we find ourselves yawning easily. Some of you may feel like, why is it when I go to sleep at night, when I go to bed, I'm wide awake, but then when I sit at the television like an hour before, I'm just nodding off and falling. So that's the point at which you're feeling sleepy. When we are fatigued or tired, our bodies may feel weak, but our minds are still alert. So the body scan practice helps us to appreciate this difference. One should go to bed when sleepy and thus likely fall asleep within 15 to 20 minutes. If you're fatigued, then one should work towards relaxing one's state of mind and body. So what is sleep consolidation? As the name implies, sleep consolidation is trying to ensure that the time we spend in bed is spent mostly being asleep. Thus, we are asked to choose a time to wake up every day, as our sleep-wake cycle is actually determined by the time we wake up, not so much by the time we go to bed, which I hope we do when we are sleepy. And so here, we are aiming to have a sleep efficiency, meaning that the total time in bed that is spent asleep is about 85%. So if you go to bed for 8 hours, the hope is that for about 6.5 to 7 hours of that, you are asleep. Now we're talking about working with sleeplessness at night. In addition to waking up at a consistent time, we now encourage members to only go to bed and stay in bed when sleepy. So remember, sleepy means that when you go to bed, you will fall asleep within 15 to 20 minutes. It is also important to recognize when we are not sleepy and therefore unable to go to bed, and allow to bring ourselves some compassion and acceptance of this phenomenon. Stimulus control is really about conditioning yourself, hoping to recondition that you no longer see the bed as a torture machine where I know when I go to bed I cannot sleep, but rather to rebuild back that sense of when I'm lying down, feeling myself in my bed, feeling the covers on me, within 15-20 minutes, there's assurance that I will fall asleep. Remember what I said earlier about patience. This does not happen immediately. We teach 1 week of sleep consolidation, and then together with the sleep consolidation, we include stimulus control. And we adjust this continuously throughout the 8 weeks because we understand that it takes about anywhere from 4 to 8 weeks before our body reconditions itself. The fifth session is the territory of insomnia. Again, we continue with formal practice or movement practices, and we also do some psychoeducation about the territory of insomnia. Dr. Victor Kwok earlier said that we've come to appreciate that insomnia is a 24-hour problem, right? It highlights two aspects of insomnia. The first is that it is a condition that not only impacts one at bedtime, but rather starts to affect one just before going to bed and even the day after. So perhaps at bedtime, you're asking, will I fall asleep quickly enough? At nighttime, even before you have thought about bed, you're already asking yourself, will I get enough sleep tonight? And then when you wait for the day, will I manage to get through the day feeling like this? AKA, not rested. The second aspect highlights how something that may become insomnia starts first with just our sleep disturbances, the difficulty falling asleep, the difficulty staying asleep, the not feeling rested in the daytime, followed by changes in behavior and over time, changes in thoughts, beliefs, and attitudes around sleep. In bringing attention to this, it is important to highlight being curious, open, and accepting of our difficulties to fall asleep with compassion. So here is where we come to accepting and letting go, where we introduce another practice called the 3-minute breathing space. And we also look into our thoughts and feelings around sleep. The 3-minute breathing practice was actually created for mindfulness-based therapy for depression, but Dr. Ong felt it was appropriate here, and it was to allow members to use at any time in any situation to mitigate the factors that may be contributing to their sleep difficulties. For example, managing stressful situations during the day, when they lack the energy, addressing thoughts and feelings that are affecting their ability to rest and affecting their ability to fall asleep. Also important, it allows them to become more aware of their thoughts and feelings as they may be having during the course of the day, and that will also inform their ability to sleep. When we were talking about revisiting the relationship with sleep, we talked about the relationships with sleep in terms of thoughts and beliefs and attitudes, as well as doing a nurturing and depleting exercise. And this sort of joins in with the territory of insomnia. So recognizing that one's activities during the day may impact one's ability to fall and stay asleep, this exercise encourages members to review their day-to-day activities and its impact on their energy level. Ideally, we would want to balance depleting and nurturing activities, as too much depleting activities may result in feeling fatigued and tiredness. This activity also helps highlight to members how they may organize their day based on the ability to have a good night's rest or not. So if you are having a day where you didn't sleep so well the night before, you had 3 nights where you didn't sleep so well, you're really fatigued, then You're going to be more attentive to trying to do more neutral or more nurturing activities before you engage in further depleting activities. What are depleting activities? Any activity that you do that drains you of energy. There's no fixed answer here. For example, for me, checking my email is a depleting activity, where for some it's a neutral activity, and for others it may be an energizing activity. So no one activity is depleting to all people. It really is about yourself in your own reflection. When we want to revisit the relationship with sleep, during the 7th session, the activity of accepting and letting go, most importantly with compassion, is emphasized. So this includes our relationship with our sleep, our beliefs, our attitudes. If you remember earlier, Dr. Kwok put up a spreadsheet where people had a thought and how they felt about the thought and what this thought means to them so that they can challenge the thought. Well, mindfulness would also want us to look at that thought, recognize that these thoughts are temporary. Watch them as though they are a train that came into your station, and you don't have to necessarily engage in them. You don't have to get onto that train, and you can watch it go on. Or just to watch them as though clouds are passing by. So here we have the relationship with sleep. And what I want to highlight is examples of how it can change. Like here, we have attention and emotional biases towards sleep. So, for example, rather than being attentive towards sleep-seeking thoughts and behavior, I must sleep 8 hours tonight. I have to go to bed by 11 p.m. to get enough sleep. There's an understanding that sleep is guided by being more accepting of my bodily states of sleepiness and trusting in that. The last session is the action plan. It serves as a review and an opportunity to prepare members for the coming days, weeks, and months after the program has completed. The action plan has members recall the sleep-related elements they have learned across the 8 sessions and identify the actions they found helpful and most able to continue to follow in the coming days, weeks, and months on their own. Members are encouraged to write this down to help remind them of their work and effort thus far. So, as mentioned earlier, Dr. Julian Lim and myself, we engaged in a research study. And so we will be sharing some of the research findings of this study that was done with 120 participants in total. 60 participants received MBTI, and another one received an active control that just taught them sleep hygiene, exercise, and education. We collected 2 types of data. We collected subjective data, which is based on self-report questionnaires that highlight the respondents' perception of their experience, and objective results that are usually measured with tools, which in this case is actigraphy. Well, it's a more accurate form of a Fitbit that you may be already wearing, as I saw from some of the Q&A discussing your Fitbit results. The following slides will illustrate these findings in graph format. So the first thing we want to show, as this is for only those who did MBTI, is that after they received the 8-week course, their scores on 5 scales of mindfulness, the ability to observe, describe, be aware, be non-judgmental, and non-reactive, increased significantly. We also have pre-sleep arousal, somatic, and pre-sleep arousal, cognitive. So pre-sleep arousal is, what are the things that are keeping you up at night? Is it somatic or physiological sensations, or cognitive, you're thinking, you're worrying? And for both MBTI and cognitive, what we can see is that there's a steady decline from pre to halfway at week 4 to post, meaning right at the end of 8 sessions. And this predicated, the caveat being that these individuals continued to practice their mindfulness after the end of the program. 6 months later, it further decreased in their pre-sleep arousal. One of the explanations for this could be the reduction in their dysfunctional beliefs and attitudes associated with sleep, which was measured on a 30-item scale that had people record how true they had this belief or attitudes towards sleep. And consequently, they had improvements in their mood and improvements in the anxiety. So sleep and mood and anxiety kind of play amongst each other. The less sleep you have, The poorer your mood, the more anxious you can be. But similarly, the more anxious you are and the lower your mood can also impact your sleep. So either way, doing the mindfulness-based treatment for anxiety, for insomnia, reduce their mood and reduce their anxiety. And this is the actigraphy data. But what I want to highlight is that they spend greater total sleep time in bed increased, and the amount of time that they were awake after sleep onset was decreased. That means their sleep efficiency, if you calculate total time in bed and the amount of time asleep, improved after the 8-week program. Finally, I want to highlight the difference between treatment response and treatment remission. So treatment response describes what is the immediate effect after the treatment. So after the 8 weeks, what was the response? And we can see this is between MBSR and MBTI. This was a study done by Jason Ong, as I highlighted earlier. And he wanted to test between MBSR and MBTI. And what we found is that it clinically improved from the initial onset of the illness. Here, there's an improvement in insomnia, a reduction in symptoms. So blue is the insomnia program, red is the stress program. And now remission means that this person has been symptom-free long enough where they now feel no longer distressed and they have returned to pre-insomnia well-being. And we see that the remission for MBTI is greater than for MBSR. Most importantly, that this persists after 6 months from the end of treatment. So how does this work? Well, one of the mechanisms for the robust response and remission of insomnia with MBTI is the cultivating of adaptive attitudes with the practice of mindfulness and bringing these concepts to bear on insomnia. Mindfulness involves developing meta-awareness and a flexible as well as adaptive response, and then the acceptance of one's experience. And this has been shown to improve sleep. So you fall asleep faster and you stay asleep longer, and there's less waking during the night. The other thing I wanted to highlight, as we talked about earlier, was meta-awareness together with acceptance and, if necessary, letting go, over time brings a shift in values, beliefs, and attitudes that shape our thoughts, feelings, and behaviors from maladaptive ones to more adaptive ones. So I hope this presentation has illuminated the use of mindfulness as a form of therapy for the management of sleep difficulties, namely insomnia, and which was creatively organized in a structured treatment by Dr. Jason Ong and has proven effective here in Singapore. So this was a collaborative effort by the Awake Lab, which is the lab that Dr. Julian does, and my lab at SGH and the SingHealth Sleep Disorder Center at SGH. On that note, thank you very much, and I give it over to you now, Julian.